just to give you a little introduction about this entire talk. Sarcodes are remedies which are made from healthy human beings and animal tissues. The main thing that we look on for sarcodes is either there is a lack or exaggeration of function of that particular area from which the sarcode is prepared. And we have a lot of sarcodes. Remedies from adrenaline, cortisone, estrogen, folliculinum, histaminum, insulinum, euphorhinum, pancreatinum, pepsinum, parathyroid gland, pituitary, testes, thyroidinum. So these are some commonest sarcodes that we use. When do we use these sarcodes? Of course, I'm reading from my new books on materia medica of nosodes and sarcode. The main genius of sarcode, when do we use it? When there is a lack of reaction in cases, or there is alternating states. Even in very complicated metabolic and hormonal disorders, this becomes very important remedies. But once you know that sarcode comes very rarely in repertory, in rubrics, and that's why it's probably very difficult to understand. And that's my idea to discuss with you many of these lesser known sarcodes and how to use them. My idea is to also talk to you about how to know some clinical hints towards these lesser known sarcodes. Of course, we know about thyroidinum, but what about other lesser known sarcodes? And I'm going to quickly, briefly tell you a little bit about some of the commonest ones that we use a lot. One of the important remedies is adrenaline, which is an extract from adrenal gland. And in today's times of very high stress, causing sudden high blood pressure, causing a lot of constriction in the chest, causing a sudden adrenaline high, causing a sudden kind of thrill experience through the body, through the mind, through the blood vessels. Adrenaline is one of the very important remedies that we use. Of course, there's a lot to discuss about in this remedy, but I just wanted to give you a genius of this remedy. A lot of writings that I've written about this. Another remedy, cholesterinum. It's a remedy, trituration of gallstones is sarcode, and it's a near specific for acute gallstone colic. Also used for many opacities of vitreous, and Burnett would use it very often for hepatic tumors. In some cases of high cholesterol, you could use this remedy. Another remedy, we'll talk about this also in the conference, is the remedy cortisone. It's a remedy we use a lot here. Cortisone, as you know, is a corticosuprarenal hormone. This makes this remedy a very important remedy in many cases where patients are taking a lot of steroids, cortisone, prednisolone, because it causes a state of cortisone euphoria where patients will develop a lot of symptoms of too much of cortisone, steroids being given, the weight gain, the slowness, the contented feeling, the sudden high cholesterol, the sudden other hormone rise. If it's a case of diabetes, sudden increase in blood sugar. And in many of such cases, we use cortisone. Interestingly, many of the sarcode remedies like cortisone, like another remedy, histaminum, are also remedies that we use in many children's cases of ADHD, of extreme restlessness. So many such clinical hints I want to give you